Like, remind me why you joined and tell me what your favorite parts have been so far.
Yeah, I think honestly, like at this point, I don't even remember exactly why I joined. I just know that I wanted something this so long, and I've learned so much that I'm like, why did I join this course in the first place? But I do remember that when I originally started, I wanted to have something that was more integrative, more holistic, that kind of allowed me to pull from different, modalities, if you will, right? Finding like, how do you tailor something for your clients so that you're not just talking, you're actually doing things. And yeah, it's been going great. And I find that everything that I've learned so far, because like I'm not even halfway through the course, very, very transparent. And it's just been really amazing to see that whatever I've actually learned so far, I've been able to immediately take it into my sessions with clients. And they've been able to kind of resonate. And it's changed how I show up for them as well. I feel like before I was probably more along the lines of, okay, let me just give you the psychoeducation piece and see where that lands. But now I can actually kind of draw it out for them, because that was the one piece that I was always like, how do I show this to clients? And so now I'm like able to actually kind of show them and explain it to them and kind of check in with them, and it's really, really great. And it's nice to also know that I'm not necessarily kind of constricted to like one specific like psychoeducation piece. There's so many different bits and pieces that I can pull from depending on what the client's showing up with. So yeah, it's been great.
I love that.
I don't know if that answers your question, but that's kind of like where I'm at right now.
Yeah, it sounds like there's two pieces. A lot of people come in and they say like it's this tricky piece of how do I bridge the gap between theoretical concepts? Like I could be brilliant, but if I don't have the digestible enzymes to really explain to a client what parts work is, or why they're having the Velcro effect, or why they're attracted to something toxic, we all know this stuff, but there's an art in terms of how do I then relate it to the client. I love how you're saying I really wanted to build that bridge. And what makes me so happy is when you're telling me that clients are actually seeing a shift, or you could use it in session, because that's really what mastery is. Yeah. Meet your client and give them the language so they see a shift. And then the integration piece, which I love that you shared, is it's like a lot of times with therapeutic healing, it's not just like parts work or somatic or a cognitive approach or an attachment approach. It's like, how do we actually take the whole mix, bring it here, and then see what actually aligns best with your clients? Yeah, they're smiling.
No, because it's true. And I feel like the more confident we get in our ability to kind of communicate and dispense the information, the better it is for the client, and it really changes their way of processing as well. Because like I'm reflecting back to like, how did I show up for my clients 6 months ago? Well, technically 8 months ago. And how am I showing up for them now? And I can see that it's not just the amount of knowledge that I have, it's also just the confidence with which I can really kind of show up for them, right? And sometimes it's like, when I was training to be a therapist, a lot of it was really like, oh, let's just be a blank slate and let's kind of, give them all these CBT thought logs or whatever. And I'm just like, I don't want to do this for my clients. And just being able to kind of show up and be like, you know what, we're going to take it one step at a time. We're really going to take the time to slow down in sessions. That's really shifted my clinical work. So yeah.
Are you saying like the ability, because I'm almost imagining myself being a client in your room, and are you talking about like the implicit confidence that gives the clients like that very anchoring, held feeling?
Yes.
Yeah, is that what you're talking about? Because it is. It's like you could have two people could have the same skills, and the clients will have a completely different experience because of like this piece that you're speaking about is the confidence of like, I got you, or I know where we're going.
Yep. Yeah, like I may not know all of it right now, but we will get you where you need to get. And I feel like that's ultimately what most of them need to hear, is we may not have all the answers, and that's okay, but we will get to where we need to get with time.
Yeah. And who would you say would be the best person to like join a course like this? Like if there was somebody in the future that was curious about joining.
Like your course?
Yeah, my course.
I think somebody that is ready to do the work and is passionate about what they want for their clients, right? It's not just like, oh, it's just another CE thing that I'm going to join and get done for my credentialing or whatever. It's if you're really passionate about the work that you do and you really want to see those transformations in your clients and even yourself, I feel like those are the people that would really benefit. Yeah. I feel like, honestly, like this kind of teaching should be something that they should introduce when we're in grad school, because a lot of this is really very practical skills that we need when we're working with our clients. And if we know all of this as we're kind of getting ready to go into our internship, it changes how you feel and it changes your client's perception as well. Because I can imagine like my first internship client, yeah, she probably was like, who is this child in front of me?
Or she might have been like, this person is wonderful. And I think, Gul, something that you're speaking about, which I love, is the transformation of the therapists themselves. I think it's a matter of like, how fiercely committed are you to being someone who's committed to growth? You literally just said earlier, right? Like how you're looking to growth and you're looking at like evolving for yourself. I think those who are looking to be very like clinically awake and emotionally awake in their lives, yes. I think there's a level of like, how do I show up for myself and my clients?
Yes.
Yeah. Yeah. What would you say to somebody like thinking about considering this program? Would you recommend this? What would you say?
I would say do it. I've said that to like some of my colleagues have asked me, they're like, what are you doing? And I'm like, I'm in Esther Goldstein's course. You know, you should look it up and like try it out. So yeah, I would say do it. I mean, it's one of those things where if this is the kind of work that you want to do and you don't feel like you want to like run down 10 million different things,
right.
It's one very complete, very cohesive course. So it's great. I would say do it.
What's your favorite part of the community?
Honestly, it's just being surrounded by like-minded individuals who are viewing the client's pain points from a place of understanding, as opposed to like pathologizing or being very quick to kind of be like, oh yeah, but this. That's usually what ends up happening, because sometimes like our clients will say things or do things and like under normal circumstances, you're just gonna like, dude, just get over it. But really, it's like understanding like there's so many layers underneath it, which is what we're seeing in sessions. So I love that. Plus also just kind of like listening to all these different cases, super helpful.
Yeah. We love having you here. Keep me posted on how this session goes, and we'll see you next time.
Yes, absolutely. Thank you so much. I really